Chronic Obstructive Pulmonary Disease by Jesse Wolfe. COPD refers to a group of chronic lung conditions caused by long-term exposure to lung irritants. It causes damage to the lungs and airways, making it increasingly harder to breathe. Smoking is the leading cause of COPD, which currently affects more than 16 million adults in the United States alone. This disease is currently the fourth leading cause of death in the United States and third leading cause of death by disease. To really understand how COPD affects the body, we must first understand the function of the respiratory system. So the structures of the respiratory system work together to perform the mechanism of respiration. The respiratory system works simultaneously with the cardiovascular system, which brings oxygen to all of the cells in the body. When we breathe in, we bring in fresh oxygen into the air sacs of the lungs, and that is where the gas exchange takes place. Oxygen is entering the bloodstream, and carbon dioxide then leaves the bloodstream as we exhale, and it leaves our body. Normally, when you breathe in, the airways bring air into the air sacs, which are both elastic and stretchy. If you have COPD, less air can flow in and out of your airways, and the airways and air sacs in the lungs become less elastic. The walls between many of the air sacs have been destroyed, and the walls of the airways have become thick and inflamed. The airways can also produce more mucus than normal and become clogged. The two main conditions associated with COPD are emphysema and chronic bronchitis. Most people suffering from COPD have a combination of the two conditions. Emphysema refers to the damage that has occurred to the tissue that makes up the walls between the air sacs. This forms holes where the air becomes trapped, stretching out the air sacs, which reduces the amount of possible gas exchange. Chronic bronchitis causes swelling and narrowing of the airways due to chronic inflammation. This in turn produces excess mucus. The narrowed airways have become clogged with mucus, which blocks airflow. Symptoms of COPD develop slowly and worsen over time. Because of this, many people are unaware that they have COPD, and damage to the lungs is already taking place. Common signs and symptoms of COPD include things such as chronic cough, lots of mucus with their cough, a lack of energy, limited physical activity, difficulty breathing and shortness of breath. A lot of people won't be able to take a deep breath in at all. Wheezing, chest tightness, and reoccurrence of colds or other respiratory infections. Those who continue to smoke experience much faster progression of these symptoms. Severe COPD can cause other symptoms to occur, such as swelling of the legs and feet, weight loss, and lowered muscle endurance. For those with ending stage COPD, things such as walking, cooking, other regular daily activities may no longer be an option at all. So when it comes to diagnosis of COPD, an accurate and early diagnosis is vital to help slow the progression of the disease. A physician will evaluate symptoms, family and medical history, if the patient smokes, if they've been exposed to lung irritants, as well as questions about their cough. Some of the diagnostic testing used in COPD would include things such as chest x-rays, pulmonary function tests, CT scans, and blood tests. The main test used in diagnosis for COPD is spirometry. It is a type of pulmonary function test that is very important, considering it can detect COPD before the symptoms develop. By blowing into a tube connected to a small machine, the physician can tell how much air a person can blow out and how fast they can do so. Doctors might also use the test results to find out how severe a person's COPD is and to help their treatment goals. An arterial blood gas test gives measurement of the oxygen level in the patient's blood by taking a small sample from an artery. This shows the physician how well the lungs can perform the gas exchange of moving oxygen in and carbon dioxide out of the bloodstream. Chest x-rays or CT scans produce images of the structures inside the patient's chest, so of things such as the heart, lungs, and the blood vessels that can show signs of COPD. They can also show if another condition such as heart failure is causing the symptoms. So unfortunately, there is no cure for COPD as of yet. However, treatment along with some lifestyle changes can help to drastically alleviate symptoms as well as slow down the overall progression rate of the disease. So some common treatment for this disease consists of things such as obviously quitting smoking. Medications can be used such as bronchodilators, which are inhaled to help relax the muscles of the airway. And then a lot of the time they'll be prescribed in combination with inhaled steroids, which will help with the inflammation in the airways as well. Regular vaccines are important to help avoid respiratory infections because people with pulmonary diseases can be a lot more susceptible to severe complications if they were to catch things such as the flu or pneumonia. Adjusting physical activities is very important as people with such drastically impacted breathing, they still need to be able to exercise and keep up their overall health. This can also help with relieving, the complications with COPD. Avoiding secondhand smoke and other air pollutants is a big one, as that goes hand in hand with, that's what caused it in the first place. Pulmonary rehabilitation consists of a personalized treatment plan created by a pulmonologist or another doctor to help the patient to learn how to manage their exercise and their eating and different things of the sort, as a lot of these things are very hard tasks now with their breathing. Surgery also for severe cases, things such as a lung volume reduction surgery or a bulectomy, as well as even a lung transplant, can be very useful and benefit patients in severe cases.